Hello and welcome to the final community assessment presentation. My name is Angelica Hernandez and I will be talking about Belmont, California and San Mateo County today. Belmont, California is a small town located in the Bay Area between San Francisco and San Jose. It is part of San Mateo County and includes other cities like Burlingame, Daly City, East Palo Alto, Redwood City, and San Mateo. Cities actually bordering Belmont are San Carlos, San Mateo, and Redwood Shores. It is also bordered by the Miramonte Ridge Hills, the Upper Crystal Springs Reservoir, and the very busy 280 freeway. Population of Belmont is about 27,000 last year. 20.9% are 18 years old or younger, and 14.9% are 65 years old and over. Belmont is a majority of white at 67.6%, with 19.9% Asian, 11.5% Hispanic, and 1.6% Black. In contrast to San Mateo County, who has a larger population, obviously, their population last year was 765,135. A little bit more culturally diverse at 53.4% white, 25.4% Hispanic Latino, 24.8% Asian, and 2.8% Black. Belmont, California does have a small town feel, but there is plenty of access to shopping centers, groceries, supplies, clothing, restaurants, alternative holistic providers. There's many of those here. There's a chiropractor, speech and language therapy, physical therapy, Reiki, and a few mental health providers. However, there's no access to primary care, urgent care, acute care services without leaving the city. Primary care and urgent care center is available in San Carlos and the nearest hospital. Sequoia Hospital is in Redwood City, and there's also Mills Peninsula Hospital in Burlingame. There is plenty of access and availability of open space, trails, and parks. There's easy access to major freeways, the 101 and 92, multiple schools, both public and private, plenty of churches and places of worship, multiple bus lines, and also a Caltrain station. And my final windshield survey was completed on Wednesday, July 20th at 11 a.m. via my own personal vehicle. As far as key informant interviews, I was able to interview Dr. Baraka Floyd, MD, who is a pediatrician. She's been a recent resident of Belmont, California since October of last year. However, she's lived within San Mateo County for at least the last 5 years. She's lived in Redwood City, previously in Belmont, San Carlos, and also San Mateo. She's been able to work with children and families of San Mateo and Santa Clara County since 2012, including Stanford's Lucille Packard Children's Hospital, Valley Medical Center in San Jose, and Gardner Packard Children's Health Center in Atherton. She states that within the last 2 years of practice, she's only experienced one positive or high lead level, and then there was also a second one that was considered high but did not require treatment. Because a majority of the population that she works with does have Health Plan of San Mateo, or our version of Medi-Cal, she is mandated to screen children at both 12 and 24 months of age. However, her concerns are for those children who live in homes with lead-based paint that continue to be at risk after the recommended and reimbursed screenings recommendations. Additionally, she also has concerns for the older siblings that are outside of the recommended ranges and not tested regularly. She states that we may be missing a whole group of older kids. Additional concerns that she mentioned were concerns for exacerbations of asthma, eczema, and allergies in children who are also living in the same similar deteriorating or unkept low-income housing. My phone interview with her was on Friday, July 22nd. A notable quote from her was, she says, "It is difficult with the 1 and 2-year-olds because they are the most at risk. They get into everything, they crawl around everywhere, and they always end up putting their hands in their mouths," which is usually how, children are exposed to lead. I was also able to interview Veronica Alvarez Javanillo, who is a nurse, public health nurse. She graduated with her bachelor's from USF in 1995, also with her public health nurse certificate. She has worked for Child Protective Services and the county within the Peninsula population. Additionally, she's worked at San Francisco General in the trauma unit. She is now and has been for a while back at the San Mateo County offices where she is still involved with CPS. She runs the Childhood-Led Poisoning Prevention Program, or CLIP. She's also involved with the Perinatal Addiction Outreach Program. She is a clinical educator for other public health nurses and has worked as a legal consultant on the side. We discuss the roles of the public health nurse in collaboration with environmental health specialists, community workers, while conducting home visits for children who have already been identified with elevated blood levels. We discuss possible but less well-known sources of lead exposure, such as parents who work in certain industries such as bridges, fishing, and shooting ranges. Lead can also be brought into the home by cultural-based home remedies, candies that are exported from Mexico and China, certain foods like grasshoppers, cosmetics such as eyeliner, kohl eyeliner from India, toys, especially from China. There is a current push to identify the homes within San Mateo County that are at high risk for lead exposure, but it is difficult because it is a childhood prevention program, so a child must be present in the home. So homes that do not have children may be at higher risk or might not be identified properly. She also wanted to discuss the importance of primary, secondary, and tertiary prevention as the roles of the public health nurse. Quote from her, she told me a story. She said, "I will never forget this 12-year-old patient. He was only screened for lead levels because he became violently ill. His blood lead level was over 100, and it is considered an emergency when the levels are found to be over 44. It turns out that he was getting some medication sent directly from his family in India, and it must have been pure lead. His family didn't know, and they were devastated." So according to the American Academy of Pediatrics, risk assessments should be done at 6, 9, 12, 18, 24 months, and then again at 3, 4, 5, and 6 years of age. Universal screening for lead is no longer recommended unless they live in a high-risk area as defined by the CDC. Additionally, blood lead levels or serum levels only recommended if the risk assessment is positive. However, the American Academy of Pediatrics does recommend to test immigrants, recent immigrants, refugees, or adopted children as soon as possible, no matter their age. Lower socioeconomic areas or people who are eligible for Medi-Cal are also at higher risk. So for them, blood lead screening is mandatory at 12 and 24 months of age only. Some states have also established screening programs for pregnant women as well. The CDC has provides statistical data based on children in California, and while the numbers appear low, only 25% of children under 72 months were confirmed having a blood lead level greater than or equal to 10 micrograms, and 2.4% were confirmed having a level greater than 5. Within San Mateo County, a total of 7,000, a little bit over 7,000 children under the age of 6 were tested. The majority at 98.41 had levels under 4.5, 1.25% had levels between 4.5 and 9.5, and only 0.34% were greater than or equal to 9.5 micrograms, which is obviously great news. However, higher percentages were seen throughout the state of California in different counties. One of them was as high as 6.13% in Siskiyou County for children between the level of 4.5 to 9.5. However, some of these statistics are a little bit misleading because they do not take into account the difference of populations of children within that county. Additionally, an important statistic is that according to the County of San Mateo, 80% of homes within the county do contain lead-based paint. The National Institute of Environmental Health Services says that no amount of lead is safe. So really no level of blood lead is safe for children. The goal is to eliminate all lead exposure within the environment. There are health effects for both children and adults, even if the levels are below 10 or if they are below 5. Children with a blood lead level under 5 they usually have decreased academic achievement, decreased IQ and cognitive measures. There is an increase in attention-related and problem behaviors such as ADD, ADHD. Children under 10 may have delayed puberty, reduced postnatal growth, decreased IQ, and decreased hearing or hearing issues. Additionally, chronic lead exposure in adults, usually from occupational sources, will result in increased blood pressure, decreased fertility, cataracts, nerve disorders, muscle joint pain, memory, and concentration issues. Proposed community diagnosis for San Mateo County is as follows. There's an increase of lead poisoning and related health effects, including permanent damage in the children within San Mateo County. This is related to parental lack of knowledge of signs, symptoms, and sources of lead poisoning. A majority of homes in the area being built before lead-based paint was outlawed in 1978. Decreased socioeconomic status and thus substandard living conditions, and lack of primary prevention efforts within the community, as evidenced by continued detection of elevated blood levels among those children that are screened, and the identification of permanent and irreversible health effects in children who have been poisoned and exposed to lead. Currently, San Mateo County does have the CLIP program. They also have a lead poisoning prevention week every October. They also follow blood lead level screening as recommended per the American Academy of Pediatric Guidelines and the Health Plan of San Mateo or Medi-Cal guidelines. My proposed intervention is to increase the primary prevention interventions. This includes lead hazard inspections and controls before the blood levels become elevated. It is important also to implement locally based legislation to mandate landlords and owners to make the necessary changes to reduce the risk for lead exposure. The majority of the current initiatives, both at a federal and a local level, are considered secondary or tertiary prevention. Screening programs detect and identify children that already have elevated blood lead levels, and it is only after they've been identified that they step in to locate and remove these hazards. It does not protect or prevent the child from the irreversible effects of lead poisoning. Additionally, application and reinforcement of housing regulations is necessary. Including in my interventions for increasing primary prevention is to increase the awareness of the issue, including the risk for lead poisoning and lead hazards and the signs and symptoms of lead poisoning. Outreach and education of lead poisoning and prevention must be addressed and evaluated. Health education within the home and the community should be focused on factors that can be easily changed to decrease the exposure. Unfortunately, written materials are often at inappropriate reading level for the average reading skills of the intended population. It was found that many of these materials were written at a 7th grade level, which is higher than the recommended levels of written materials. They should be written closer to the 4th to 6th grade level in an attempt to reach as many people as possible. This reflects the importance of community assessment before implementation of health education. A final thought is from the American Academy of Pediatrics Council on Environmental Health. They state that the focus of prevention should be on reducing the source of childhood lead exposures rather than just identifying children who have already been unduly exposed or attempting to ameliorate the toxic effects of lead exposure. Key to preventing lead toxicity lies within the ability and attempts to identify and eliminate the major sources of exposure. Primary prevention really is the most optimal strategy because of the permanent effects of lead poisoning, even with low-level lead exposure, are irreversible. Here is a list of references. Thank you so much.